Hi, this is Dr. Tom, and now that you have successfully completed phase 2 and lost all of that weight, we are now going to talk about going into phase 3. Phase 3 is the phase in which we want to lock in this weight loss. We want you to continue to be successful at both weight loss and at least maintaining your weight. At this point, you have made permanent lifestyle changes, you are eating better foods, and you are doing a moderate amount of exercise. You have just lost a tremendous amount of fat in a short period of time, and because of the eating habits that you've had through phase 2, we want to teach you during this phase in order to remain successful for phase 4.
Hi, I'm Lisa. I'm here to talk to you about phase 3 of the HCG weight loss program. By now, you may have seen significant weight loss, and I bet you're pretty excited with the change in your size and how you look and how your clothes fit. Phase 3 is the most important part of the HCG program in my opinion. This is the part where you lock in your new metabolic rate and you tell your body that this is where you want to stay. This part of the program lasts for 21 days from the day of your last injection. The way it works is this. You'll take your last injection, whether that's day 23 or day 40, and for 2 days following, you will continue to follow the HCG diet as you have been for the previous days. You will get up in the morning, you will urinate, take your weight, and then you will continue to eat the 500 calories. On the 3rd day after your last injection is when you will actually begin phase 3. Your day begins very similarly. You'll get up in the morning, use the bathroom, weigh yourself without any clothes on, and now you will actually go to eating a breakfast, lunch, and dinner meal. Your calorie restriction at this point is 1,200 calories. Your food preferences and choices are much wider at this point. You are allowed to have any food you choose except for the ones specifically listed in your manual. The things that are not included during phase 3 are anything that contains starch or grain or sugar. So that would include wheat products, that would include rice, corn, potatoes, winter squashes. The only fruit you are restricted from at this point are bananas and dried fruit such as raisins, figs, or prunes. You are not allowed to consume any alcohol during this part of the program or any added sugar. That means if you are eating a piece of fruit such as a strawberry or blueberry or an orange or a mango and there is naturally occurring sugar, that is not a problem at all. It's only if there's any added sugar. During this part of the program, we expect your weight to stabilize itself. So it is important for you to continue to weigh yourself each morning. If you gain more than 2 pounds from whatever your finishing weight was, for example, if you finish at 200 pounds and on somewhere in phase 3 you are up to 203 pounds, we would like you to use the steak diet as described in your booklet. During this part of the program, you will consume nothing for the day outside of water and a very large steak at dinner time. Along with the steak, you may have an apple or a tomato. You may use no salt, but any other seasoning is acceptable. This usually will help our patients to step back into the weight that they were at prior to having to use the steak day. If you gain more than that and a steak day is not working, please contact our office and we will give you some direction. At this point in the program, you may also begin to resume your more strenuous exercise. There is no limitation on your exercise. We do want to see you at least walking daily. It is also important to continue to keep your water intake up. This means anywhere from a half a gallon to a gallon a day. You may have coffee, you may have water, you may have milk, you may have almond milk, you may have tea. You may use milk in your coffee or tea again if you prefer. If you're going to use a sweetener, that sweetener should be stevia and should not be honey maple syrup, sugar of any type besides, again, what is naturally occurring in the milk. This part of the program is important to remember that there is no restriction in terms of what you are eating. It is important that you include breakfast daily, as this sets the tone for the day and helps to keep your blood sugar even and regular. At the completion of this part of the program, you will have a scheduled phase 4 appointment to talk about how you should eat going forward and being able to maintain the program. If you have more weight that you would like to lose, you may continue to stay in phase 3 for a 6-week period and then may resume injections again and go back into the phase 2 part of the program to continue to lose more weight. If you have any questions about how this phase works, please feel free to contact our office and we will be happy to assist you. Thank you.